Patients hear all the time in the media today that they can have minimally invasive surgery. But what is minimally invasive surgery? Surgeons are always looking to achieve the best results they can with a minimal amount of scarring, of course, or incisions, and also a very short downtime. Everybody today lives a very busy life and wants to get back to their professional and social activities just as soon as they can. And so all of us are seeking to achieve the very best result with the very least intervention. Now, before we talk about actual minimally invasive surgery, we must mention that in fact the most minimally invasive thing we can do today are the non-surgical procedures. We have wonderful improvements that we can perform in the facial rejuvenation with things like Botox, fillers, facial peels, and aesthetics. And of course, these are not invasive at all, except that they require a little puncture with a needle. Now, when you have Botox or fillers, of course, you can get some bruising or you can get some swelling. And there can be a little bit of downtime with that. But we have ways to minimize that. When it comes to surgery, we consider minimally invasive surgery in the forehead, for example, by performing an endoscopic forehead lift, by making smaller incisions rather than one longer incision to elevate the brows and improve the wrinkles in the forehead. When it comes to the eyelids today, we can make an incision just in behind the lower eyelid to remove all of that puffy fat, which makes one look older, more tired, and indeed even a little bit sad. And so there's no incision made outside at all in that particular circumstance. We also look at minimally invasive face and neck lifting surgery. And indeed, there are some procedures in which a very short incision in front of the ear can be made and get a satisfactory result. However, there is a caveat. Like many things in life, there's not always a free lunch. And so for some patients, depending upon how much sagging they have, indeed, they may be much better served by having a procedure that's not quite so minimally invasive, but provides a better result. But those are just a couple of examples of how we can perform minimally invasive procedures, surgical and non-surgical, to achieve you the very best result with minimal downtime and a rapid return to your normal activities of daily living.